For today, we will be discussing the Universal Healthcare Act of 2019. So, for the past lectures, we have been talking about um, the community part. So, we have been discussing the current situation in the Philippines, the global health situation, and napapahapyawan natin na sa UHC, ganito, ganyan. But now, let's go into more detail on what universal healthcare is. So this is just an introduction na. Meron pang um, further details on the UHC, but I think this is pretty much what you need to know at this point. Bless you. So just a quick history on the UHC. Republic Act number 11223, so that's easy to remember, or the Universal Healthcare Act, was signed into law on February 20, 2019 by then Philippine President Rodrigo Roa Duterte. The UHC Act automatically enlists all Filipinos in the National Health Insurance Program and prescribes the necessary reforms in the health system to enable access to a wide range of health services while protecting the people from financial hardship. Basically, that's what UHC is. So remember, it's Republic Act 11223. So I hope you'll remember that since pagdating sa boards, they also want they also want you to remember these things. So Republic Act 11223. So the main objectives of this UHC Act is to progressively realize universal health care in the country through a systemic approach and clear delineation of roles of key agencies and stakeholders towards better performance in the health system. It ensures that all Filipinos are guaranteed equitable access to quality and affordable healthcare goods and services and are protected against financial risks. It allows improvements in the processes in the health system that ordinarily will not be pushed forward without further legislation. So it makes it easier for us to implement improvements with the UHC. These are the Declaration of Principles of the UHC Act. First, it is an integrated and comprehensive approach that ensures health literacy, healthy living conditions, and protection from hazards and risks. It is a healthcare model that ensures access to a comprehensive set of quality and cost effective health services without financial hardship. It's a whole system, whole of government and whole of society approach in developing, implementing, and monitoring health policies, programs, and plans. And it is a delivery, people-centered delivery of health services. So the UHC Act makes use of an integrated, comprehensive approach. Yun yung sinasabi nilang whole of system, whole of government, and whole of society so that all Filipinos has a healthy home, school, workplace, which will allow them to have a healthy lifestyle. The main principle here is that a Filipino is matched to a primary care provider. Uh, Actually, it's a primary care provider team pala, not just a primary care provider that will ensure quality healthcare access that's delivered at the right place. So, whether it's at the hospital or at the OPD at the right time, and that every Filipino's health spending is predictable and will not force them to financial ruin because of adequate and effective safety nets that are in place. So, yun yung sinasabi nila na dapat ang spending ng Filipino with the UHC implemented hindi na sila yung mababankrupt dahil sa healthcare spending. So, saan naman nagagaling ang funding ng UHC? So, hindi siya one funding source lang. So, nandyan yung total incremental sin tax collection. You have your national government subsidy to PhilHealth. You have your supplemental fundings. You have annual appropriations of the DOH. We have the premium contributions of the members. 50% of the national government PAGCOR share from funds from PAGCOR and PCSO, which will be pulled into PhilHealth, and 40% of the charity fund, net of documentary stamp tax, and mandatory contributions of the PCSO. So, madami siyang sources of funding, which ideally will be able to sustain the UHC. So, let's go to topic 2, which is financing. So, first, yung population coverage. Take note that ang sabi natin dito sa UHC Act is that every Filipino citizen is automatically included in the National Health Insurance Program. Every Filipino citizen. Ang coverage niya is that every Filipino is granted immediate eligibility and access to preventive, promotive, curative, rehabilitative, and palliative care for medical, dental, mental, and emergency health services. The health services will be delivered either as population based or individual based. So, note here that there's immediate eligibility and access to the services. Ano naman ang population-based or individual-based? I think na-discuss na natin to before. Ang population-based services are interventions which have population groups as recipients. So services included here are your health promotion, surveillance, and vector control. For the individual-based services naman, these are services which can be definitely traced back to a single recipient. So which includes your inpatient care, medicines, labs, and procedures. So for the financial coverage naman, the population-based health services are financed by the national government through Department of Health and provided free of charge at the point of service. Population-based health services at the local level are financed by the LGUs and supported by the DOH. For individual-based health services, these are financed primarily through prepayment mechanisms such as your social health insurance, private health insurance, and HMO plans. So for your PhilHealth membership naman, there are two categories. Or your direct and indirect contributors. Unlike the previous system where PhilHealth membership had categories, under the UHC, they will simplify it na. And it's just going to be direct and indirect. So let's go to direct contributors first. So these are the people who have capacity to pay premiums. They are those who are gainfully employed or are self-earning, professional practitioners, and migrant workers and their qualified dependents. So that includes your doctors, your engineers, your teachers, while your indirect contributors are those who are not included as direct contributors, whose premiums are subsidized by the national government. So kasama dito yung mga indigents, your senior citizens, and your PWDs. For the entitlement naman of benefits, every Filipino citizen is granted immediate eligibility nga for PhilHealth benefit packages and would no longer be required to present a PhilHealth ID before they avail of the health services. Dati kasi very strict sila when you go to a hospital, kailangan dala mo yung ID mo. Ngayon, we usually just ask them to go to the PhilHealth area or PhilHealth booth, PhilHealth office sa hospital. Ibibigay lang nila yung pangalan nila para ma-check kung active yung membership. Next is that current PhilHealth benefit packages in the implementation of UHC will not be reduced. So, I think nag-improve pa nga din ang coverage ng PhilHealth for the um, for a lot of their packages. So again, for your entitlement of benefits, so your copayment will not be charged to patients for health services rendered in basic or ward accommodations. Home payment and co-insurance amenities in public hospitals will be regulated by the DOH and PhilHealth. And your copayment refers to a flat fee or predetermined rate paid at the point of service, while co-insurance refers to a percentage of medical charge paid by the insured and the rest paid by the health insurance plan. For the premium contributions naman, for direct contributors, the premium rates will be collected in accordance with the following schedule and monthly income floor and ceiling. Pag formally employed ka, it's split between your employer and the employee. While for indirect contributors, the premium subsidy will be gradually adjusted and included in the annual general appropriation and released to PhilHealth. So, kunwari ito, so if your current income is nasa 10,000, in 2019, your the premium rate then was 2.75%. So, they just multiply it. That's a 2,700. Ay, ano ba? 10,000. 275 pala. Yeah, that's 275. Pero tumataas siya every year. So 2025 nasa 5% na tayo. So 500 ang natin contribution if you are at the income floor na 10,000. Next, for the service delivery, for the health services, population-based health services refer to interventions such as health promotion, disease surveillance, and vector control, which have population groups as recipients. Number two, for the delivery of population health services, province-wide and city-wide health systems will be developed and contracted by the DOH. Number three, the minimum components of your province and citywide health systems include primary care provider network with patient records accessible throughout this health system, accurate, sensitive, and timely epidemiologic surveillance systems, proactive and effective health promotion programs or campaigns. For individual health services, these are services that can be accessed within a health facility or remotely that can definitely be traced back to one recipient. Has a limited effect at a population level and does not alter the underlying cause of illness, such as ambulatory, inpatient care, medicines, laboratory tests, and procedures, among others. PhilHealth will contract public, private, or mixed healthcare provider networks to deliver individual health-based health services. Number three, upon contracting, the networks with each of its healthcare providers agree to minimum components that include one, assurance of patient access to services, two, service quality standards, three, co-payment or co-insurance, and data submission standards. For your healthcare provider network, so this refers to a group of primary to tertiary care providers such as public, private, or mixed that offer care in an integrated and coordinated manner in the primary care provider acting as a navigator and coordinator of healthcare within the network. So ito yung nakita natin before. So yung mga primary care, so yun yung mga health stations, health centers, and your level 1 hospitals. Um, then your secondary, tertiary, nandiyan na yung mga bigger hospitals which give specific health services for each. Outside of the healthcare provider network, Apex or end referral hospitals may be contracted as standalone healthcare providers by PhilHealth. So these are the hospitals under the DOH na. The very specialized hospitals na such as your heart center, your RITM, um, NKTI, etc. In paying for the healthcare provided their networks, PhilHealth will shift to performance-driven, close-end and prospective payments based on disease or diagnosis-related groupings and validated costing methodologies without differentiating facility and professional fees. So what they do here is that all all your diagnosis, when a patient gets admitted or when you sign out a patient, meron silang ICD din. So, dapat pasok siya doon para makikita kung ano yung rate. And they check this. There's an parang like a compendium ng ICD codes. Tapos, yun yung kilala ni PhilHealth na malalagyan nila ng tag later on kung magkano yung um, costing nila for that type of illness. They develop differential payment schemes considering service quality, efficiency, and equity. Institute strong surveillance and audit mechanisms to ensure the network's compliance to contract commitments. I think part of this is all these forms that they ask the doctors and the hospitals to provide, which is actually very taxing to do. Um, since they want nga na to ensure the that PhilHealth will be given, they have these forms like CF2, the CF4, wherein dapat nandun yun nga, yung ICD based diagnosis mo. You have your course in the wards there as well. So imagine if your patient stayed there for a long time. You have to be able to plug in your course in the wards, all the meds, all the labs that you were able to do for you to get for your hospital and for your doctors to get paid. So that's one thing na one big issue with PhilHealth for the past years. Even with even before UHC started, medyo madaming hinihingi si PhilHealth para makakuha ng payment ang hospitals and the doctors. And mind you, in some private hospitals, umaabot na ng 100 million ang hindi pa napapay ng PhilHealth. That because of this, because they're saying it's return to hospital daw yung papers. Some of them, parang if you see the log ng doctors, ng mga your of the consultants, minsan as far as 2020, hindi pa sila na may pasyente pa silang hindi na pa-process. Hindi pa sila nababayaran. Hindi pa nababayaran ng hospitals. So I think that's one thing that PhilHealth should fix before the 100% implementation of PhilHealth, of the UHC. Kasi nga hindi siya magiging sustainable if the hospitals and if the doctors don't get paid, di ba? So, wala akong I have no personal stake here in PhilHealth kasi wala naman tayo sa OSMA na PhilHealth sharing, but that's something that you have to consider, especially when you have your private practice na. So, alam niya ng mga if you have relatives or parents na doctors, alam nila yung hirap kung paano magbayad si PhilHealth. Anyway, I digress, but let's go to human resources for health. So, under the UHC Act, a National Health Resource Master Plan will be developed and implemented by the DOH. The HHRMP will provide policies and strategies for the generation, recruitment, training, regulation, retention, assessment, and securing of permanent employment and competitive salaries for the workforce. A national health workforce support system will also be created to address human resource needs of local health systems with geographically isolated and disadvantaged areas as priority areas of deployment. Under the UHC Act, the following will be carried out to support capacity development for human resources for health. One is expansion of existing and new allied and health-related degree and training programs, where the number of enrollees will be regulated based on the health needs of the population. Two, expansion of scholarship grants for allied and health-related undergraduate and graduate programs based on the needed cadre of national and local health managers and professionals. And three, reorientation of medical and allied medical education and professional certification and regulation towards developing competencies in providing primary care services. So here, with the launch of the UHC, they also started the primary care um, cert- primary care worker certification program back in 2020, I think. So it was just because it was during the pandemic, they made it like a course um in the DOH website. So all nurses, all health professionals, all doctors were advised then, who are in the primary care, were asked to get a certification. So that's what we all did during the residency. And madali lang siya. I think you can actually answer all the questions there. If as long as you um listen to the course. Even this UHC um lecture, this was also from the DOH website. They made it really um non-lawyer professionals friendly. Number three, and under the UHC Act, a 3-year return service is required for college scholarship grant recipients who graduate from their courses. Return service will be rendered in priority areas in the public sector with compensation and under the supervision of the DOH. So next, your local health systems. Your province-wide and city-wide health systems. One of the biggest problems of our health system is the inequities that are present across the municipalities, di ba? And these inequities happen in part due to the variable prioritization of health services of local and administrations across different municipalities. This is what we mentioned before na swerte ang LGU that prioritizes health. But some LGUs kasi do not prioritize health as much, especially those who are in the far-flung areas. So under the UHC, the DOH, DILG, PhilHealth, and the LGUs shall endeavor to integrate health systems into province-wide and city-wide health systems. So your province-wide health systems will be composed of your municipal and component city health systems, while your city-wide health systems, on the other hand, refer to highly urbanized city or independent component city health systems. The provincial and city health boards shall oversee and coordinate the integration of health systems for the province-wide and city-wide health systems. In addition to the members of the Provincial Health Board as stipulated in the Local Government Code, a representative from the municipalities and component cities that are part of the province-wide health systems will also be included. The provincial and city health boards shall oversee and coordinate the integration of health services for the province-wide and city-wide health systems. In addition to the members of provincial health board as stipulated in the local government code nga, ayan pala yung that's the same as earlier. Um, they will be coordinating and provide oversight in the integration of health services for province-wide or city health systems. The board shall exercise administrative and technical supervision over the health facilities and the human resources within the respective territorial jurisdiction. They shall also be in charge of managing the Special Health Fund. Ano ba ang Special Health Fund? So the province-wide or city-wide health system shall pool and manage through a special health fund all resources intended for health services. This shall be used to finance population and individual-based services, health system operating costs and capital investments, remuneration of additional health workers, and incentives for all health workers. All income derived from PhilHealth payments shall accrue to the Special Health Fund to be allocated by the LGUs exclusively for the improvement of the LGU health system. PhilHealth payments shall be credited to the annual regular income of the LGU. The national government shall make available commensurate financial and non-financial matching grants to improve the functionality of the province-wide and city-wide health systems. Underserved and unserved areas shall be given priority in the allocation grants, and grants shall be in accordance with the approved province-wide and city-wide investment plans for health. For the regulation, to ensure safe and quality health interventions and services delivered to all Filipino citizens, there are two two factors that they will be doing. First is the incentive scheme. So PhilHealth is tasked to establish a rating system and incentivize, acknowledge, and reward facilities that provide services at a set safety and quality standards. We also have the third party accreditation with the ISO. To achieve this, PhilHealth is tasked to recognize third party accreditation mechanism as a basis for granting the incentives. So, hindi lang sila yung basta-basta nag-i-implement ng um, or hindi lang sila yung sariling gumagawa ng mechanism nila for granting the incentives. In terms of licensing of standalone facilities and the use of CPGs, to complement, DOH will institute a licensing and regulatory system for standalone facilities, including those providing ambulatory and primary care services. The DOH will also set standards for clinical care through development, appraisal, and use of CPGs with professional societies and the academe, patient groups, and other relevant stakeholders. In the DOH websites, there is a tab there for the compendium of approved CPGs. So you can check that out if you want to do some leisure reading, or if you want to do additional readings and be updated on specific disease management and diagnosing these diseases. So these CPGs are usually very practical, and then they update it talaga every once in a while. For affordability, to ensure affordability of drugs and devices in the public sector, an independent price negotiation board will be constituted to negotiate prices on behalf of the DOH and PhilHealth, guided by related policies issued by the Government Procurement Policy Board. So all drugs, all meds, all devices and supplies are go through um, biddings. So hindi siya basta-basta binibili, or hindi siya basta-basta kung sino yung nag-offer, yun agad yung kinukuha nila. So they want to assure affordability, but at the same time, they want to assure quality pa rin. So hindi din lahat ng mura, yun yung kukunin nila. The negotiated price in the framework contract will be applicable for all health facilities under the DOH. So isa lang ang procurement process nito. The members of the price negotiation board will include representatives from the DOH, PhilHealth, and the DTI. Under the UHC Act, all DOH-owned health facilities will be required to procure drugs and devices guided by the price reference indices and centrally negotiated prices, sell at prescribed maximum markups, and submit to DOH a price list of all drugs and devices procured and sold. All DOH-owned health facilities will also be required to submit to DOH and make readily accessible to the public information on prices of all health services and goods offered. Likewise, all drug outlets will be required to carry the generic equivalent of all drugs in the primary care formulary and provide customers with a list of therapeutic equivalents and their corresponding prices when fulfilling prescriptions. In addition, the DOH, PhilHealth, and Health Maintenance Organizations, or HMOs, and life and non life private health insurance will be required to develop standard policies and plans that complement benefit packages in the national health insurance programs. For equity, to ensure this in the delivery of health services, the DOH is tasked to carry out preferential licensing of health facilities and contracting of health services in underserved areas. The DOH is also tasked to guarantee the equitable distribution of health services and benefits by providing the geographically, ano to? Ano nga ba ang GDAS? GID is geographically isolated pala and disadvantaged areas in the provision of assistance and support. Under the UHC Act, the prescribed allocation of authorized bed capacity for basic or ward accommodation in private, public, and specialty hospitals will be as follows: 90% for government hospitals, more than or equal to 90%, more than or equal to 70% for specialty hospitals, and more than or equal to 10% for private hospitals. So, yan, 90, 70, and 10. Health promotion naman will be scaled up and strengthened to employ a whole of society and whole of government approach to improve health literacy and to create enabling environments for Filipinos so that they are able to make healthier choices. To meet this demand, the health promotion and communication service of the DOH will be transformed into a full-fledged health promotion bureau. To know more about the changes prescribed for the health promotion initiatives of the health government, eto yon. So with at least 1% of the DOH's total budget appropriations allocated for health promotion initiatives. Wait lang, naputol to guys. I will ito to follow ko tong ano natin dito. Yung initiatives nila. Ito yung next. Under DHC, the schools under the supervision of the DepEd are designated as healthy settings. And as regarded DepEd and DOH are tasked to formulate programs and related learning modules that may be integrated into existing school curricula. Ito din, ba't hindi lumabas yung mga yan? I will give you the other details for this. Ayan, next. As your evidence-informed sectoral policy and planning, to support succeeding policy, research, and planning initiatives of DOH and PhilHealth, all public and private national and local health-related entities will be required to submit health and health-related data to PhilHealth, including administrative, public health, medical, pharmaceutical, and health financing data. In addition, all health, nutrition, and demographic-related administrative and survey data generated using public funds will be considered as public records and made accessible to public unless otherwise prohibited by law. The DOH and Department of Science and Technology will also develop a cadre of health policy and systems researchers, technical experts, and managers to develop the capacity of the DOH in generating evidence for policy research and planning in support of the UHC. Qualified grantees will be provided training grants with globally benchmarked institutions and will be required to serve for at least 3 full years as well, with compensation under the supervision of the DOH, PhilHealth, and other relevant government agencies. Research grants will also be made available for participatory action research studies or cost-effective, high-impact interventions for health promotion and social mobilization. For the monitoring and evaluation, the PSA or Philippine Statistics Office will conduct relevant modules on household surveys annually for the first 10 years of implementation of the UHC and thereafter follow its regular schedule. In addition, the DOH will be required to publish annual provincial burden of disease estimates using internationally validated estimation methods and biennially using actual public and private sector data from electronic records and disease registries to support the LGUs in tracking the progress of health outcomes. For health impact assessment under the UHC, policies, programs, and projects proposed by entities outside of the health sector and are crucial in attaining better health outcomes or may have impact on the health sector will be required to undergo the health impact assessment process. Your health technology assessment is the systematic evaluation of properties, effects, or impacts of health related technologies, devices, medicines, vaccines, procedures, and other health related systems, utilizing a multidisciplinary this process to evaluate the social, economic, organizational, and ethical issues of health intervention or health technology. The HTA process will be institutionalized as a fair and transparent priority setting mechanism, providing evidence based recommendations to both DOH and PhilHealth in developing policies and making relevant decisions. In conducting the HTA process, specific criteria are observed during including responsiveness to magnitude, severity, and equity, safety and effectiveness, household financial impact, cost effectiveness, affordability, and viability. In relation to this, a health technology assessment council will be created within the DOH and transferred as an attached agency to the DOST within 5 years of establishment and effective operation. Their primary functions include facilitating provision of financing and or coverage recommendations in health technologies to be financed by the DOH and PhilHealth, oversight and coordination of the HTA process within the DOH and PhilHealth, review and assessment of existing DOH and PhilHealth benefit packages. The operations of the DH TAC will be supported by a secretariat and a technical unit for policy planning and evaluation with evidence generation and validation capacity. The implementation of the UHC Act will be strengthened by commitment of all stakeholders to abide by ethical principles in public practice. All appointed decision makers, policy makers, and staff involved in all policy determining activities are required to declare and manage all conflict of interest. All manufacturers of drugs, medical devices, and supplies registered by the FDA are required to collect and track all financial relationships with healthcare professionals and providers and make this list publicly available in accordance with existing laws. A public health ethics committee will be consulted as an advisory body to the Secretary of Health to ensure compliance with the law. To support the implementation of the UHC Act, all health service providers and insurers are required to maintain a health information system consistent with the DOH standards and electronically uploaded on a regular basis through interoperable systems. The health information system will consist data on enterprise resource planning, human resource information, electronic health records, and electronic prescription log. So this is also one of the things that we are actually waiting for, yung health information system that is which is cohesive, that will um, be used in the primary care setting from your health centers to your hospitals as well. Para na rin, as we said before, hindi na ulit-ulit yung mga patients when they get your history. And then kita natin lahat na naging management na sa patient from the very start. And so that's pretty much what the this that's That's pretty much the introduction on your UHC. So that's the pinaka-basics. Pero ang daming very wordy, very meaty siya. Pero as I've said before, hindi naman perfect ang UHC natin and marami pa silang kailangang um, i-iron out. But what's nice about this is that the improvements in the healthcare systems is easier with the implementation of the UHC na hindi na kailangan nga mag-undergo ng additional legislations. Talagang we're just really working to improve the health system with this one. All right? So, I think that's the last slide. Meron lang tayong um, quick assignment slide